I'm now joined by Norman Brooks, Project Director for the National Minority Organ Tissue Transplant Education Program. He joins us at the Howard University Health Pavilion. Thanks for joining me today.
Thank you for inviting me.
It's a pleasure to have you on the show.
Yes.
Now, we're old friends, too.
Yes, we are.
Because we've done this drill many times over many years.
Yes, we have.
But talk to us about what the National Minority Organ Transplant Donor Program is doing. What are you guys doing here at the Pavilion, and what's the program's agenda overall?
Actually, National MOTTEP.
Yes.
The acronym is MOTTEP.
Yes.
National Minority Organ Tissue Transplant Education Program.
Yes.
Our objective is to encourage people of color to live a healthier lifestyle and to consider becoming an organ donor.
Now, what would you like them to do in order to adopt a healthier lifestyle? I have some ideas, but...
We have actually enrolled with Howard University Hospital and an organization called Health Pack. So we have partnered with them to go out into the community to bring an awareness on health. And our role, as I mentioned earlier, is to encourage people to live a healthier lifestyle, change their diet, exercise more, at least 3 times a week, half an hour to an hour, depending on how much they can endure, and to change their lifestyle completely so that they don't end up on the list needing a transplant. If you live a healthier lifestyle, the chances of you needing an organ such as a kidney or a liver diminish because you've changed your lifestyle.
And so you're really addressing the problem from both ends of the spectrum.
From both ends of the spectrum.
It's time to name the News 4 morning person for this Tuesday morning. Suzanne Marshall is a program coordinator for the Minority Organ Tissue Transplant Education Program at Howard University. Executive Director Patrice Miles sent in Suzanne's picture. They've been working together for 12 years.
Suzanne gets to work early and is always asking how she can help, her boss says, and Suzanne often leaves fresh fruit or a greeting card on Patrice's desk to get her day off to a good start. Suzanne also drives her boss to speaking engagements so that she can concentrate on what she's going to say without having to worry about traffic.
MOTTEP. It's the Minority Organ Tissue Transplant Education Program. Since 1993, the National MOTTEP organization has provided education to minority communities about the importance of organ and tissue donation. MOTTEP has programs in 15 cities across the country and reaches more than 4 million people thanks to community outreach programs, businesses, and the media. Here's a sample of what people are saying all over the country about MOTTEP, the Minority Organ Tissue Transplant Education Program.
There's a movement among African Americans to keep the giving spirit alive all year round by encouraging organ donation. Correspondent Anthony Mason has the story in tonight's Eye on America.
In Washington, D.C., Dr. Clive Callender has been leading a national organ donation crusade. The chief of transplant surgery at Howard University Hospital, Dr. Callender has found that blacks' reluctance to donate has been due in part to
religious myths and misperceptions, concerns that in that great getting up morning that you go to the pearly gates that St. Peter will say, no kidney, no entrance, or one kidney, one wing.
The folks at Jackson Memorial Hospital today kicking off the first ever Minority Organ and Tissue Education Program. They're hoping to educate South Florida's large minority population about the gift of life.
This is Fox 6 News at 9.
Good evening, I'm Art Franklin. First on Fox tonight, a critical shortage of African-American organ donations in Alabama. Internal organs, kidneys in particular, are in huge demand with hundreds of sick people on a growing waiting list. So many that local healthcare professionals today drew up a plan to do something about it.
Well, they set up an advisory board to manage the Minority Organ Tissue Transplant Education Program, encouraging more African Americans to become organ donors. Donors like Jeffrey Johnson, son of former Birmingham Police Chief Johnny Johnson, who nearly 3 years ago gave his mother a kidney.
I would recommend it highly. It's worth it. We need it.
Money does not play a role in transplantation whatsoever. Bobby has now dedicated his life to making black people more aware of this great need. But in this community, Bobby says myths about organ donation run rampant.
Few people have more empathy for what Walter Payton went through than David Greer.
It was scary. You're talking about a life and death situation.
4 years ago, David was diagnosed with primary sclerosing cholangitis, the same liver disease that put Walter Payton on the transplant waiting list. David was lucky. After 9 months of waiting, his pager went off at 2 in the morning.
I saw the number of the Cleveland Clinic on there, and for a few minutes I didn't answer, and it went off again. And they told me to get down to the hospital. They had a liver waiting for me.
David now works for the Minority Organ Tissues Transplant Education Program. Elia Hall-Smith is the director of the Minority Transplant Education Program. She says there are many reasons minorities don't want to be donors.
It has to do, often to do with some of their religious beliefs, which may be true or not. One of the things that we try to get people to understand is that most religions support organ donation as a gift of life.
It was a race to help those running out of time, minorities needing organ and tissue transplants. 5-time Super Bowl champion Charles Haley shares their frustration. He's been searching for more than a year for a bone marrow donor for his 4-year-old daughter Brianna, who has leukemia.
We tried everybody in the family and nobody came up as a match, so we're looking for an unrelated match. So it's just like playing football where you need that 11th guy to step in to make the difference, and we're looking for somebody to step in and make the difference.
Bone marrow donations are also low among minorities, mostly due to the misperception that it's a painful procedure.
Dr. Callender?
I think it's important to put things into proper perspective. The blind can see, the lame can walk, the deaf can hear. These are miracles that can occur when people leave tissues behind. So even if it were only for the tissues, it's well worth the while. All Americans should have the right to have a home. They should have the right to have health care. Thirdly, they should have the right to leave organs and tissues behind after death. All Americans.
As witnessed, National MOTTEP has been able to utilize one of the most powerful and effective tools, the media, to promote the message of saving lives through organ and tissue donation and transplantation.
It's a nice Monday morning out here on the plaza. Big crowd, kind of a carryover, I think, from the weekend. Some very special folks here for a very special cause. What's your name?
Patrice.
And why are you here today?
We're here to celebrate National Minority Donor Awareness Day. More than 89,000 people are on the national transplant waiting list. Over 44,000 are ethnic minorities, and we're encouraging all of them to sign donor cards, have a family discussion, and also live a healthy lifestyle to prevent the need for transplantation.
Great cause. Thanks for coming out today. Appreciate it. God bless. Let's get a look at what's going on across the country. Weather-wise, satellite picture shows showers and thunderstorms will re-fire up over the southeast once again, and they don't need it down there, but there could be locally 1 to 2 inches of rain, some flooding possible. The southwest as well, seeing some
Hello, I'm Dr. Clive Callender.
I'm Dr. Ernest Carter.
On behalf of the Howard University National Minority Organ Tissue and Transplant Education Program, we welcome your participation. National MOTTEP now has a Project Export Telehealth Center on renal disparities.
Yes, as your personal physician has already told you, hypertension is a very serious life-threatening illness.
But the good news is, hypertension can be controlled.
A team of physicians and scientists from Howard University created this kiosk just for you.
By inviting you to participate in this program, we can help you help yourself prevent your hypertension from leading to more serious illnesses such as kidney disease
or stroke.
And so we urge you to
come to this kiosk at least twice per month.
Weigh yourself.
And take your blood pressure.
Then view and listen to the information on this system about how to control your disease.
and then you can actually speak to a nurse practitioner about your disease. Our project staff in your city.
Our team here at Howard University will all work together to help you keep your hypertension under control. Yes, we know you have hypertension, but together we will control it.